Manawanatumpko. I'm Elizabeth Turk, and I'm a Peace USA mission coworker in Madagascar. My husband Dan and I have been working with Peace USA's partner church, the FJKM, since 1997. I partner with FJKM's AIDS and Health Ministries. Madagascar is a country with many paradoxes. There is amazing natural beauty and biodiversity, a population that is hardworking and resourceful. But it has one of the highest levels of poverty in the world. Many people make hard choices every day. Will they be able to feed their children 3 meals a day? Can they spend $10 to see a doctor if their child is sick? Can they afford to send their children to school? Please be aware that the statistics I am sharing give a picture of the challenges that most Malagasy face daily, but they do not define who they are. The Malagasy people have a sense of community and a capacity for joy that defies their circumstances. That being said, here are some of the health challenges faced by the Malagasy people. Over half the population lacks access to safe drinking water and proper sanitation. It is estimated that 100 Malagasy children die a day from common and preventable diseases like malaria, diarrhea, malnutrition, pneumonia, and measles. Childhood vaccination rates are low. Madagascar also has an extremely high rate of maternal mortality, with 10 Malagasy women dying a day from complications related to pregnancy and childbirth. Less than half the population has adequate access to a healthcare facility. Madagascar has the world's 4th highest rate of chronic malnutrition among children. There is now a famine in southern Madagascar exacerbated by COVID-19 and drought. And then in March 2020, Madagascar started dealing with COVID-19 cases. The FJKM feels strongly that the church must take action in the face of such circumstances. Let me share a few ways the FJKM is working to address the health needs of the Malagasy people. One way the FJKM is addressing the matter of malnutrition in the South is through a program at Siumbe. An FJKM church in the capital, Atsimu Mamasana, started this evangelism outreach program in southern Madagascar. This building serves as the church and school for the community. All of the children who attend the school get a healthy meal. The Atsimu Mamasana Church is looking at long-term food security solutions with the Siumbe community. A rising HIV rate is another problem that Madagascar faces. Although Madagascar's HIV rate is estimated to be less than 3%, in the last 10 years, while the rest of the world's new cases have declined by 23%, Madagascar's new cases of HIV have increased by almost 200%. FJKM got involved in the fight against HIV and AIDS with the planning conference in 2001. I'd like to introduce some of my colleagues in the AIDS Committee. Pastor William Razafi Machacha is the president of the FJKM AIDS Committee.
Hello, greetings from the FJKM AIDS Committee, or KPMS as it is called in Malagasy. I am Pastor William Razafi Machacha. I am president of the KPMS, fighting the spread of HIV/AIDS, caring for those who have HIV or AIDS is very important to the FJKM. We have been doing this ministry since 2001. Thank you for all that you are doing to help us with this important ministry. Very smart thing done. Elizabeth Turk will share about what we are doing. We thank you for your partnership. We will be praying for you in the United States as you deal with the COVID crisis. May God bless you. Amen.
Sorana lehibe ny PCUSA noho ny fiara-miasa lehibe entin'ny PCUSA amin'ny fanatotosany ny KPMS amin'izany iraka asa vavolombelona amin'ny ady amin'ny sida zany arefa.
The FJKM recognizes that a key component to fighting the spread of AIDS and fighting stigmatization is education. They have produced many educational materials that are shared during trainings and HIV testing events.
Anisan'ny mampiavaka manokana ny KPMS ny fampianarana ny 10 minitra ny ady amin'ny sida ny amin'ny fiangonana io.
Seminary students at all 5 of FJKM seminaries get at least 40 hours of training on HIV/AIDS before they graduate. An important component of this training is meeting someone who is HIV positive. The lady in yellow is Maya, and she is HIV positive. Maya was HIV positive when she delivered her daughter, Mommy, the little girl in the purple dress above me. Mommy is HIV negative. Maya shared about her experiences with the students. Meeting an HIV positive person helps seminary students prepare for the time when they may need to counsel an HIV positive person and his or her family. It also helps them understand the importance of fighting stigmatization in the church and society. During their training, seminary students get time to practice counseling skills. In 2018, recognizing that only 10% of the HIV positive people in Madagascar were getting tested, the Malagasy government asked for help from civil society to promote testing. The FJKM responded positively. To help fight stigmatization, President Ami got tested publicly and allowed his picture to be used to promote HIV testing. From 2018 to February 2020, the FJKM has held 10 events and has been able to test over 3,000 people, with 6 people testing positive. This policeman was one of the many tested, and he was willing to have his picture shared to encourage others to get tested. With COVID-19, there have been many changes in the AIDS program. HIV testing is now on hold until the government approves testing again. There is still a plan to do HIV testing at FJKM's General Assembly when it is rescheduled. Training seminary students was delayed, and when it started back up, things were a bit different with masks and social distancing. The trainings at all 5 seminaries have now been completed. Recognizing the hardship of COVID, the AIDS Committee made a gift of food to seminary students and their families and staff at each of the 5 seminaries. The FJKM AIDS Committee also accompanies many HIV positive persons. Maya counsels those who have been newly diagnosed. This assistance has been even more important with COVID-19. I also work with FJKM's Development Department Health Program. Through its 32 mostly rural dispensaries like this one, FJKM is improving people's access to health care in remote areas. The dispensaries offer prenatal care and family planning services, which help reduce maternal mortality. FJKM medical personnel treat the common illnesses found in Madagascar, like malaria, measles, and respiratory infections, as well as offering vaccinations. Many dispensaries also do simple deliveries. Peace USA is assisting the FJKM medical staff to get in-service trainings and equipment like microscopes and ultrasound machines. There is still a great need. The FJKM Health Program has helped many communities get safe drinking water over the last 10 years. FJCAM's Youth Peer Educator Program is another exciting program that equips youth to be able to share positive life skills with their peers. Youth learn about the risks of alcohol and drugs, teenage pregnancy, AIDS, and other sexually transmitted diseases, as well as how to set goals and do long-term planning. The training is biblically based and challenges youth to make life decisions that reflect a growing relationship with Christ. During their training, they get opportunities to practice how to share positive health messages with their peers. In 2019, FJCAM trained 40 youth peer educators in Majunga, a city with one of the highest HIV infection rates in Madagascar. They were scheduled to do a follow-up training Easter 2020. When COVID-19 hit, many things changed. My FJCAM colleague, Dr. Voangi Rainaivuarison, explained some of the COVID impact on the Development Department's health program. The Development Department is known as SAF.
How has COVID impacted the SAF's health program? The first thing is that we have not been able to implement our regular program. Training and supervisions have been postponed. In the beginning, we could not get needed protection supplies to our medical staff and dispensaries. Fortunately, no one got sick with COVID. In some places, people stopped going to the dispensary out of fear of COVID. There is not enough medicine to treat diseases. Now, things are returning to normal except for family planning supplies.
With assistance from Peace USA and others, the health program was able to get dispensaries needed protective supplies so they could receive patients safely. The health team has also produced educational posters about COVID-19, like this one, with funds from Peace USA. Health messages about COVID have been put out on the radio, and teams of volunteers have been trained so that they can explain the reason for preventive measures and encourage people to continue practicing them. Perspectives for 2021 for the AIDS Committee. They would like to provide HIV testing at major events like the FJCAM General Assembly, to continue training seminary students and Synod AIDS committees, to produce educational materials, and to accompany HIV-positive persons and their families. Perspectives for 2021 for the health program. They would like to supervise peer educators and do follow-up trainings that they were unable to do because of COVID in 2020, to provide lab equipment and training for 6 dispensaries, to conduct in-service training for medical personnel, to find a reliable source of family planning supplies for dispensaries, and to open new dispensaries in remote areas and ensure quality service in existing dispensaries. And they plan to continue COVID-19 education and care as needed.
How can the Madagascar Mission Network help? We would appreciate prayers for our medical staff and the people they serve. We can also use help with assistance for dispensaries that are open and to open new dispensaries in remote areas. One important need is help with family planning supplies. Our program with youth peer educators also needs assistance. Any help you can give to the Development Department to realize its mission to seek the good of the many so that they may be saved. 1 Corinthians 10:33 would be great. Thank you for all that you are doing. Goodbye. Velomatupko sa miutay n'Andriamanitra daholo.
Through its AIDS program and health program, the FJKM is working to reduce illness and suffering in the Malagasy population and equip them to live healthier lives. It is a very concrete way of showing God's love. There is much work to be done, especially with the complication of COVID-19. Your assistance will make a difference in the lives of Malagasy children and can change their future. Thank you for joining in this exciting partnership with the FJKM. Wanyanja Mancha Nivunacha. May God be honored in all we do.